Clare is a registered nurse and nursing academic with a Master of Public Health focused on promotion and advocacy.
Following her stage 1 lipedema diagnosis, she created an evidence-based education platform to translate research into practical information and improve awareness of the condition.
She's dedicated to advancing early diagnosis, reducing stigma, and improving care through education, research, and advocacy. And you can follow her on Instagram at Nurse with Lipedema.
Back to the Lipedema Podcast. We are your hosts, Shell
and Tiana, and today online we have a special guest, a registered nurse and nurse academic. It's Clare Pettit. Hi, Clare. Thank you for joining
ladies.
us.
Thanks for having me.
Oh, it's so wonderful. And I came across you, Clare, when you started your Instagram account, which we will share in our show notes. And I absolutely love your content, and so does a lot of our community, actually. It's really spoken to people in a really rapid way.
Yeah, it's just kind of really took me by surprise. I'd just been recently diagnosed with stage 1 lipedema, and when I found out, I felt quite alone in it. And so I was trying to discuss it with, friends and family, and no one was really quite understanding. And I thought, you know what, there have to be other women out there that I can connect with and, share stories with and kind of lean on for a bit more support. So I started this platform, and I think within about 2 or 3 weeks, there were just a good couple of thousand people following along for the journey, and so many women messaging me. I've had a couple of women call me through Instagram, and it's been such a lifeline since being diagnosed, and it's been a really beautiful space to meet so many incredible women, and I've definitely felt less alone in this in being diagnosed with this now.
Love to hear that. So it's cathartic for you, as well as being such a good service to our community that follows you on Instagram. Well, we're going to actually delve into your personal experience with lipedema today. And so I guess the first question is, what made you realize something wasn't right in your body?
Well, look, I had 2 pregnancies very close together. I had both of my children essentially back to back. So I gave birth to my first child, and then within 7 months I was pregnant with my son. And during that pregnancy, I guess I'd held the pregnancy weight a little bit differently. My legs felt quite fluidy compared to my first pregnancy, and I kind of just wrote it off as, weird and wonderful things that happen to our body when we're carrying a baby, and didn't think too much of it. During the postpartum period, it wasn't that my body, had bounced back. I don't like to use that word, but it just kind of wasn't, I guess, readjusting to my pre-pregnancy body the same way it had with my first daughter, with my daughter, with my firstborn. But I just put it down to being in that postpartum period and just kind of pushed it to the side. And about just over 12 months of being postpartum, I was invited to join in on training for a triathlon. And I did some pretty intense, cycling, running, swimming for about an 8-month period. And after I competed in this triathlon, I thought, you know what, I think I just need to give my body a break. I've had 2 pregnancies back to back. I've just always been to the gym like 4 or 5 days a week, and, doing 12-hour shifts on my feet in the clinical setting when I first started out in nursing. And I just thought, I'm going to take like 6 months of just really relaxing, doing some beautiful walks every day, and just getting into Pilates. So after I'd finished the triathlon, I was, going into this new kind of focusing on my health and well-being, and I put on about 8 kilos in the space of 5 months. And that was still with doing Pilates 4 or 5 days a week and still walking every day. And I just thought, this is really scary. Like, what is going on with my body? Got quite concerned. And so I made an appointment with my GP, and, she said to me, look, you're approaching the age of 35 now. Generally around this age period, a lot of women start to notice that their metabolism slows down, and you need to be very mindful about your, calorie intake. You need to be getting your heart rate up every day. Although Pilates is fantastic, you need to be running, you need to be weightlifting, you need to be doing all of these things. She checked my thyroid and everything was fine. So I decided from there, I spent the next 8 months really focusing on shifting this 8 kilos. I went and joined like a weightlifting gym. I had my FitnessPal app, calorie counting, being really mindful, really reducing the takeaway, any alcohol consumption, refined sugars, all of those things. And nothing was shifting. And my body just felt like it was becoming really edematous, becoming really puffy and really full of fluid, and particularly around my hips and my buttocks at the time. And I was like, oh my goodness, like this is just wild. And then I thought, okay, look, what I'm going to do, I'm going to sign up to a half marathon. I'm going to sign up to a half marathon and I'm going to run 3 to 4 days a week. And I was like, this is going to shift that 8 kilos. And by this age, I was probably up to about 9 or 10 because it was still just kind of adding on. And I was doing all this running for about a period of 5 months. And while I was doing this running, my legs were just becoming really fluffy. Like that's the only way I can kind of describe it. Lots of fluid. I'd be wearing like ankle socks and just, the skin would just be almost like seeping over my sock line. And I just put it down to the amount of time that I was, pounding the pavement, going out for the runs and doing a long distance running as well. And the pain that I was experiencing, I just put it down to the running itself. I didn't understand at the time that the feeling that I was having in my legs was not normal. Anyway, as I was doing all this running, I just kept gaining the weight, just kept going. And I just thought that not so much like fat weight. It was like fluid. It was like inflammation. And after I did the half marathon, I went and made an appointment with my GP, a new GP, because we had relocated out of Sydney. And I had explained all of this to her. And she took one look at my legs. She started feeling around and she was like, I think you have lipedema. And, before I went in for that appointment, I did what everyone should not do. They Googled my symptoms and I was like, oh, I reckon this could be it. I was convinced that it was not lymphedema because it was symmetrical in both legs. Anyway, so I wasn't surprised when she told me, but I was heartbroken. I was scared. I was really upset and I just didn't know what was going to happen from there. So being the type A personality that I am, I was like, I'm going to go get a second opinion. She's a great GP who I have down here, but I just wanted to get a second GP to have a look at them because this is all diagnosed based on a clinical assessment. So I went to Sydney, I saw my GP up there and she was like, yes, I think that your doctor down the South Coast has hit the nail on the head and that you have this condition. And so we made a plan on how to best manage it. And it's just been a minefield. It's been a lot to adjust to, but I feel like now, being about 8 months after being diagnosed, I feel like I'm starting to get into a bit of a rhythm with it. But, it's hard. It's hard.
It is. And 8 months is still very early on in your journey. And the consumption of all the information and all the things you should do is quite overwhelming.
Yeah, the cognitive load of all of that.
Massive.
Like, even though you are like a clinician, it's still it's a lot of information, but it's
a lot of
itself.
information.
And it's very different when you're dealing with your own personal experience than when you're looking at somebody.
And now I can completely understand why, so many women message me saying that they are going to their GP appointments and feel like they are experiencing gaslighting because I don't think that there's enough awareness around this condition. And I think a lot of clinicians who don't quite have their head around it might not feel comfortable enough to hone in on it adequately. And so then it just gets skimmed over and then this person goes on for years and years and progresses from stage 1 to 2 to 3. And then it just becomes a nightmare. And then it becomes a really big public health issue because then that's going to leave you susceptible to so many other comorbidities as well. So it's a really big problem.
Yeah,
as you know.
There's also that authority bias that happens as well. Like we think that doctors know best.
Yeah.
Yes. Yeah. I completely understand that. And I think that is what a lot of women who I've spoken to talk about. And I think what happens is, and I see it a lot of the time in the clinical setting, you'll be looking after a patient. So I used to work in the cardiothoracic ICU and the CCU, and people have had really big surgeries. and they will talk to me about all these concerns that they have and all these questions. And then as soon as the surgeon walks into the room, just stop and get nervous and don't ask and don't advocate enough for themselves. And it seems to be exactly what you said, this kind of authoritative figure issue. And I think that's what happens when women go into a GP setting. I don't feel like that when I go in to speak to a GP, whether that's just because I've worked with doctors for a long time and I just, it's never been an issue. But I can really appreciate that that's a really big problem for a lot of people.
Yeah.
100%.
Mm.
We spoke about like the physical presentation of your lipedema throughout that journey, but I'm really keen to know, once you got your diagnosis, how did that change how you saw your body?
Oh my goodness. It kind of, I guess it was almost like a relief. It was almost like, it sounds so wild to say that, but it was a relief to know that it wasn't my fault. Having this weight gain and it being so resistant to diet and exercise, it was never anything that I did. And so it kind of helped me to forgive myself a little bit in that kind of perspective. And then of course in the early days I went down the rabbit hole and I'm Googling images of all of the different stages, and I got really scared. I got really, really scared and really concerned, and I started to just have this really big shift in the way that I looked at my legs, and I got a bit self-conscious, and I just started wearing more pants more often. And then I just thought, no, this isn't healthy. This isn't okay. You need to find a way to accept it, move on, and just take it in your stride and do all the things to manage it in the way that I best can. And my GP was incredible. She said to me, you're allowed to be angry. You're allowed to be really, really upset. You're allowed to wallow in it for a hot minute. And she's like, once you've done that, put your big girl pants on and find a really good way that we're gonna find a really good way that we can treat this and manage it together. And so I've just tried to like shift that mindset, and having like a platform where I've been able to talk to other women about it has been really helpful, and it's built a lot more confidence back up in myself as well, knowing that, it's not just me, it's happening to thousands, millions of women as well.
And
Yeah.
You've gotten a great response online to sharing your story, but also I wanted to touch, just before we move on to what you do to support your lipedema, just the response that you get, that because your presentation is like, you're not stage 3, stage 4, and you don't live in a larger body. And so is there this, people are just craving this community, and so they reach out to you and they support you. But is there the other aspect where you're not, I know I've experienced it, where like the stage 1 and the stage 2, they don't have the representation because it feels like we're not sick enough?
Yeah.
Yes. And if you feel like people just think that you're kind of, are you delusional? Like there's nothing wrong with your legs, they look fine. Is that kind of what you mean?
Yeah, sort of. Yeah.
Well, I wish I had legs like yours.
Yeah. Yeah.
Yeah.
We should be able to block those words from social media.
Yeah. Look, I've had people, I put up one reel and I think it had I think about 500,000 people viewed it. And I'd had a comment on there, and it was something like, it was very negative. It's essentially talking about how nothing looks like, your legs look fine. Like, do you really need to be spreading this kind of false kind of sense of, issues with your extremities on a social media platform? And it really got me thinking that everyone presents differently. My pain that I experience with my legs could be the same kind of pain that someone with stage 4 experiences. They just look different. When I have a flare up, it's excruciating. Yes, I don't look like I have really big legs or anything like that, but the pain is there. The nodules under the skin are very evident. The swelling is significant, especially when I have a flare up, and it can feel really debilitating at times. And, a lot of people do say, well, you don't even look like you have it. And it's like, well, some people don't look like they have so many other different chronic conditions, but they do. It's almost like a hidden disability. No, it's not a disability, but like, this hidden condition that
100%.
And if not treated if not managed, it can turn into a non-hidden disability. And that's not, progression is not determined. It's a chronic condition, so it doesn't go away. It doesn't mean that you will progress throughout your life.
Yeah.
But if it's not managed, some people do progress and it becomes an actual disability. And nobody wants to get to that point. So early identification and management is key.
Well, that's right. And that's what we've been saying. That's what we're pushing for, that early identification.
Yeah.
But if people aren't thinking that you've got enough wrong with you at that stage,
and this is where it
hitting your
becomes
head against a wall.
And this is where it becomes a really big public health issue. So if we can manage this at stage 1 and recognize it sooner and stopping this from progressing to, for example, stage 4, and generally at stage 4, a lot of women who are sitting in that kind of level might experience challenges in regards to then a high BMI, obesity, and then they present with other chronic conditions such as cardiovascular issues, metabolic issues, physical issues, respiratory issues, and then that in itself then costs the public health system far more money than it does to manage it at an early stage. So this is why it's so important that we raise the awareness so that we can start getting all of the things applied with rebates so that we can intervene now before it's going to cost, public health, government sector, millions of more dollars in the long run. I feel like we will get there eventually. I think it's going to happen. I really do. Women like yourself and, everyone out there that is doing everything that they can in terms of research and advocacy. I feel like there's a really big push for it. And I think give it time and we will start seeing a change. Just have to be really proactive with it.
Yeah, I love that you're so hopeful about that. I have a bias towards it might not change, and because the political system is so short-sighted, and so they don't care about long-term health. They care about public health, but they care about, the public health that you can see here and now and what's going to move the needle immediately. So they get
It'll take one politician to get diagnosed with lipedema, and then the right politician in the right area for this to hopefully drive some change,
I know, and I don't wish for this condition on anybody, but also that would be really handy.
It would be a little bit handy right now, for sure. Yeah.
So I guess I'm really curious to know, what does supporting your lipedema look like in this season of your life?
Yeah, so I'll just be full disclosure, very mindful about this as a treatment plan for myself. It's not a recommendation that I'm giving to anyone out there. So at the moment, I have made a plan with my doctors. I've seen a plastic surgeon to discuss whether or not liposuction was an option for me at this time. And she was fantastic. And she said to me, look, you are stage 1. She's like, I think that we can keep this at bay if we make all of the appropriate interventions right now. We're lucky that we got it so early. So she said to me, I want you to continue on the tirzepatide injections. And that was, just to be very clear, that's not a treatment that's going to, fix lipedema. I had that really big weight gain, and how it was explained to me was we need to get your weight under control, because the more that you keep putting on, the more adipose tissue is going to start pooling in your extremities, the more inflammation, etc. So what she wanted to see, my plastic surgeon, was for me to lose that weight back down to the healthy size that I was, postpartum with my first child, measure my legs at the same time. So as the weight's going down, she wanted to see if the legs were going up. And if they were, then we would revisit the conversation about liposuction in the next 6 to 12 months, which I was really happy with. And on that as well, I've had so many people ask me, why wouldn't you do it right now? Like, it's so much better to do it at stage 1. That's fine. For a lot of people, that is the case. For whatever reason, as part of your individualized care, no problems. For me personally, I didn't want to have liposuction. I watched it as a student nurse, and it's the only time during a theatre placement I had to sit down. It really yeah, it really scared me. I was young, but like it just really scared me. And so I was really happy with the decision not to go ahead with that. That might change later on, and that's fine as well. And so with the tirzepatide as well, I've just had a recent appointment with my GP to talk about that because I'm down to about a healthy range that I was postpartum with my firstborn. And we've discussed together, and she's recommended that I remain on it for quite some time. Because there is emerging research to suggest that it can help with inflammation and pain. And I felt really good with it as well. So that at the moment, daily walking has been just like one of the best things I do. I find that when I have been sitting stagnant all day, I can feel my lower legs I can feel all the fluid just pooling, So also in summer, just putting my legs in the ocean was just felt such a big pain relief. So I was doing that a lot. And we had quite an extended summer here in Australia. So I was able to do that right through April as well, which was great. And then the vibration plate I found has been helpful too. And also just cutting out alcohol, not completely. I still love a spicy margarita, but just being a little bit more mindful about, processed food, alcohol. It was recommended that I go on a keto diet, and that was a hard no for me.
Yeah.
So just trying to embrace more of like a Mediterranean diet as well. Lots of good fats, lots of not so processed foods as well. And just looking after the skin on my legs as well. That's been a really big thing for me that I think a lot of people glaze over. Yeah.
Yeah, I certainly did.
Yeah, I think that I've looked after a number of women in the clinical setting who have lymphedema. So yes, very different. But again, all of that swelling, your skin can become very dry. It's stretching, can become quite painful, bruising, etc. So I've just been focusing a little bit more on, looking after my skin as well, and just my mental health more than anything.
Yeah.
As well.
That's a big one. That is such a big one. And it's one that gets glossed over, I think, because we worry so much that we're hitting all of these other things that we're supposed to try. Like every other strategy we try to see if it works for us, and we forget about our mental health and the load that takes on as well.
And imagine when a young girl who's going through puberty, so as we know that research suggests that the onset of lipedema occurs during big hormonal changes in a lifetime, which is generally puberty, pregnancy, menopause. Imagine having a young girl going through puberty and watching her body change and not understanding, and then going through adolescence faced with all of these challenges. Imagine how much that's going to affect their mental health.
Yeah.
That needs to be a really big priority area, is on young girls too, and having an idea of what to look out for and having the appropriate interventions to help support someone through those really vulnerable years, especially, with your body image and things like that.
Yeah, it's such a pivotal part of a young girl's life. Like that puberty, finding out who you are, figuring out your likes, your dislikes, like all of that. And then to have a body that's different. 100%.
Absolutely. And my daughter said to me, she said it to me a couple of times. She probably hears me talking about it all the time now. She said to me the other day, Mum, am I going to get lipedema? And I was like, maybe. Like you might. But that's okay because we know what to look for and we will know how to manage it and you'll be okay.
Yeah.
And I felt really lucky to be able to know what, the signs. But yeah, lots of families out there who would have no idea, not for any fault of their own, but there's just not this awareness.
Speaking of families, did you go down a bit of a rabbit hole and see if anyone in your family has lipedema?
Yeah, so when I was first diagnosed, they wanted to see pictures of my mum's legs. So the two GPs and the plastic surgeon all wanted to see photos of my mum's legs. So my poor mum, she's like, try to take photos of her calves and, send them through to me during all these appointments. And they found it quite difficult to determine if she might have it or not. Yeah, I think because all of the women in my bloodline have got pretty juicy ankles anyway, it was kind of hard to determine it. But then my sister's now convinced that she has it as well. We've got very similar shaped legs. For her, where she gets a little bit concerned about is that kind of fold over the knee.
The knee. Yeah.
Yeah, I don't have that. And so she's now, her algorithm on Instagram is all just lipedema. And so she's like, I reckon I might have it too. But yeah, nothing definitely like official.
That's interesting.
Yeah. Yeah, because it is wild when you start. And like you said, the juicy ankles.
Yeah.
Like a lot of people be like, oh, no, that's just how our legs are. It's, like the rose.
Yeah.
The rose.
But it's funny.
Or,
Like going back to the discussion about puberty though, like I do distinctly remember when I went through puberty and I'd gone from like this, scrawny kid to then being 11, 12 years old, and just absolutely my body changed. Like it went through puberty, like I put on a lot of weight, and I remember looking at my legs and being like, why do my ankles look why do my legs look bigger than the other girls in the playground? Like nothing, crazy, but like just always wondering, why do I always why do they look a little bit different? And then through high school, being, obviously, going through finding yourself and body image stuff, etc., and always kind of thinking, oh yeah, like the shape of my legs really are different from other girls. But I'm still quite convinced that my onset was primarily through that postpartum pregnancy period rather than then. Yeah.
Two pregnancies in quick succession is pretty crazy on your body.
It was. And then that's why I think it was really hard. Yeah, it was just kind of really hard to get to the bottom of it because my body had changed so much, and then it was recovering, and then it was pregnant again, and then it was recovering again. And yeah, it's been a bit of a wild ride for the last few years for sure.
It sure would have been. So how do you live a full life alongside your lipedema instead of letting it like make you put your life on hold or defining you? Like how do you approach that?
Yeah, well, I think that, like I said earlier, it really emotionally hit me pretty hard when I was first diagnosed with it, and I could feel myself wallowing in it. And I was finding I was getting so upset, and I thought, no, like I can't do this. I have committed my career to the healthcare sector. I've gone and done my postgrad in public health, literally in public health advocating, specializing in health promotion and advocacy. I was like, I need to do that for myself right now. I can't wallow in this. And that was a big push for starting that social media platform and just trying to turn lemons into lemonade now. And just rather than looking at this as this big, awful issue, I'm like, no, I'm going to work towards helping find a change and spend more time doing some serious research into it. That's something that I've got in the bag happening hopefully next year, and I'm excited about, which I'm really excited for. So yeah, and then just taking care of my mental health, making sure that I am protecting my mental health, that I don't go and every single photo to do with lipedema and get myself down a rabbit hole, and just accepting it. And the advice that GP gave to me has always stuck with me. You're allowed to be angry. You're allowed to be frustrated. You're allowed to wallow right now, but put your big girl pants on and you just need to crack on now.
Yeah.
Such good advice.
Yeah, it was.
That. All right. Last question, Claire. What do you wish someone had told you before diagnosis?
I think that I would have wanted someone to tell me that I should go and seek. I don't know how to answer this one. I'm really sorry.
No, don't be sorry.
I think it's because the way that I'm thinking about this is I'm thinking about all the women who have reached out to me and sent me messages and tried to go get a diagnosis, and they experience all this gaslighting. And my advice in that scenario would be keep going, keep advocating for yourself until you find someone that will take you seriously.
Yeah.
Does that make sense?
That's really good advice. And even though that wasn't the specific question, I think it's important to flip that into that very thing, because you have personal experience with people reaching out to you just wanting some help. And if that's the advice you give, that's the advice people need.
Yeah. I think that's probably what I would be more leaning towards answering with that question, because people are just not feeling confident enough to advocate for their health. They go into a GP appointment, they kind of just nod their head and go, okay, and shut down and then walk out, and it doesn't get managed, and then it progresses, and then it becomes a really big issue when it could have all been intervened earlier.
Yeah.
Yeah.
That's great.
Yeah. So I think on that, like, I think if you go in there with the information and you hand them something, maybe there's less chance of that. No, on Lipedema Australia's website, like you can download information, have a checklist, so you can check through it, and you could take that to your doctor as well. So then you're giving them something, and you can say, I think I have this. So that sort of breaks that barrier between you and them, because you're handing them the information. So I think that's really powerful.
Yeah, the resources on the Lipedema Australia website are so handy to have if you are going to a clinician for the first time, just to legitimize your thoughts, I suppose.
Yeah, absolutely.
Helpful.
And I guess also like knowing what you want. You want help, you want management. You need to, see your dietitian or see a physio. Like, these are the things that are going to help me. Give me a referral. Let me do it.
And there is nothing wrong with going into your GP, and I don't think a lot of people realize this. There is nothing wrong to go into your GP and say, I think I have this condition. This is my history. And if they still are not getting anything from this person, say, I would like to be referred to a specialist. Can you please send me, if you don't think it might be this condition, lipedema, well, then can you please send me to a vascular surgeon who can then maybe rule it out or can take you on the journey to the next referral, etc.
Yeah.
Get a referral to a plastic surgeon, all of those things. You need to be able to advocate for yourself, and there is nothing wrong with asking your GP that.
I think that is very powerful because people don't know who to ask for. So it would be a vascular surgeon, a physio, an OT,
plastic surgeon.
Another one popped in my head and now I can't remember what it was.
Well, in my brain, it was a lymphatic therapist.
Yeah, that was it. Yeah. A lymphedema clinic.
Yeah,
so they're
absolutely.
Like 4 options that you can ask for.
Yeah, absolutely. And there's no reason I can imagine why a GP wouldn't, at least entertain the idea of doing that. And if they don't, then no problems, off to the next GP.
Yeah. They're
Keep
not
going.
the GP for you.
Shop around.
Yeah. Keep going. I know, like, randomly enough, but a lot of women from Canada have messaged me. I know, really strange, but I think that the healthcare system in Canada, that would be really interesting to do a deep dive into research into how it's managed in this particular country, because so many of them message me saying that it is absolutely, when they go into the GP, it is just disregarded straight away, will not entertain the idea of it. And that's really sad. That's really scary. It's really concerning. And I really feel for a lot of women who are experiencing that. Yeah.
Well, I think Canada's only recently got an association, like a Lipedema association.
Yeah, wow.
Quite new.
Yeah, good.
So there is help coming their way, but it's only very fresh and very new.
Yeah.
And also we have, Lipedema Australia have a professionals membership now too. So in time, you'll be able to go onto their website and find someone near you that knows about lipedema.
Yeah, good. And it's also, on that as well, I think just one really important thing as well to kind of take away from this too is that if you do think you have lipedema, go and speak to the appropriate people about this. There are so many people on social media who are like, oh, you can out diet lipedema with this. You can do this exercise program to get rid of that fat, all of that kind of stuff. And that is absolutely terrifying. It is really scary.
My cream that got rid of lipedema, and
I've had 2 men in the last fortnight message me, 2 personal trainers, message me to collaborate to help me get back to my body through exercise with them, and that they have a good client base with women who have lipedema. And I was like, have you listened to anything on my platform, what I've talked about? Like, no. No, you cannot cure it with your 28-day workout challenge.
Yes. Oh, man.
Yeah.
We'd all be cured if that was the case.
Absolutely. 100%. But yeah, there's definitely a difference between having a support network on social media with other women and story sharing and, all of like a really safe space to talk about these things. But when it comes down to actually being diagnosed and having the appropriate treatment plan, you need to be doing that with the appropriate people as well. It really scares me when I see a lot of women who talk quite freely about the GLP-1 medications, almost suggesting it to everyone with lipedema. And that's not safe. That's really scary because that's not for everyone. It is so
It's not affordable.
individualized.
So we're also
It's
discriminating against people as well.
Yes,
Same with the surgery.
absolutely.
Yeah.
It's not accessible to everybody.
Yeah.
No, the surgery, I had a woman from Queensland message me and say that she was quoted up to $80,000 out of pocket
Yeah.
for liposuction. And that's, that's outrageous.
Yeah.
Scary.
Yeah.
That's your retirement fund.
Yes.
Yeah,
Oh.
but seriously, but even things like I've banged on about this so many times on my platform, but like just the compression garments, $120, $220, like that's a lot of money that people can't afford to pay for. Even just like that, the injections, if you are recommended to be on the injections, that is $100 a week. And then all of the appointments, it all adds up.
Yeah. It's an expensive condition.
It is.
It is.
And with multiple
it is.
conditions attached to that also have expensive treatment
It
plans.
brings all its friends along.
It does.
And the lymphatic massages, more than anything, that is so highly recommended from so many specialists, and that's $130 a week. Like, it all adds up. It's crazy.
Yeah, it is. Yeah. Well, Claire, thank you so much for coming on and talking to us about your experience. I will continue looking onto your platform, Nurse with Lipedema, I believe it is, on Instagram. Thank you so much for sharing your journey and for being part of the community. It's so nice to have more people talking about their experiences, but also from your clinical background, I also think there's a legitimacy to the way you talk about lipedema as well. And so we thank you for that.
No, thank you so much. I thank you for all the advocacy work that you're both doing as well. It does not go unnoticed. It's really appreciated.
Thanks, Claire.
Bye.
Thanks, ladies. Bye.
This episode is proudly sponsored by Morpheus Publishing, helping people with lived experience turn their stories into powerful published books that inspire, educate, and create change.
Visit www.morpheuspublishing.com.au for more information.
Lipedema and its symptoms vary from individual to individual. The opinions and advice voiced in this podcast are of a personal nature and used for educational purposes.
Please take away from this podcast what resonates with you, and please see your GP or preferred specialist for diagnosis and healthcare. We are Shelley and Tiana from the Lipedema Podcast. Until our next episode, bye for now.